a huge day, but this is just the start of a vaccination programme that will last many months. And there is hope that other jabs could also be approved soon. Our medical editor, Fergus Walsh, is with me now. And if we just take a step back, it is extraordinary that less than a year after the first cases of coronavirus were diagnosed here in the UK, this vaccination programme is unfolding.
Sophie, it's a great day for science and for humanity, and I think it's the first step in a very long road towards getting out of this pandemic. And to have a highly effective vaccine in less than a year is astonishing. It was by no means certain back in the spring. There are lots of viruses we don't have vaccines for. Over the past 20 years, more than £10 billion has been spent on research trying to find a vaccine against HIV without success. And we don't just have one vaccine, we've got several. We've got the Moderna vaccine that looks effective, and then we've got the Oxford AstraZeneca vaccine that the UK has ordered 100 million doses of. Now today, that team were the first to publish their trial results data in a peer-reviewed medical journal. Really important for transparency. And if, as we hope, that vaccine is approved before the end of the year, that will really speed up the rollout in spring 2021, because it doesn't need to be kept at ultra-low temperatures just in a fridge. And that will really help getting this pandemic and seeing the end of it at some point next year.
Fergus Walsh, thank you. Well, the latest government figures show there were 12,282 new coronavirus infections recorded in the latest 24-hour period. The average number of new cases reported per day in the last week is now 15,308. 1,359 people have been admitted to hospital on average each day over the week to last Thursday. 616 deaths were reported. That's people who died within 28 days of a positive COVID-19 test. That's almost 100 more than this time last week. It means on average in the past week 428 deaths were announced every day, and it takes the total number of deaths so far across the UK to 62,033. The Prime Minister will travel to Brussels tomorrow to have dinner with the President of the European Commission, Ursula von der Leyen, to try to unlock a post-Brexit trade deal. Negotiations remain stuck with only weeks to go before the transition period ends at the end of December. The politicians hope that meeting in person will find a solution.
First coronavirus vaccine and with it... At 6:31 this morning, she became a little more remarkable. Margaret was given the first coronavirus vaccine and with it a place in British medical history, a place she doesn't regret.
I would say go for it. Go for it because it's free and it's the best thing that's ever happened.
Has anything come close in your lifetime to this moment?
No, I can't think of anything. This is a terrible, terrible disease, so we do want rid of it, you know, so anything that helps. It's a bonus, isn't it?
Maggie has just become the first ever patient in the Western world to receive the coronavirus vaccine. It marks the beginning of the end of this pandemic, and she's celebrating with a cup of tea. It was, of course, a day of firsts, not just for Margaret. May was the first to administer the jab.
It was historical for my career, for the human race.
That's it now that you started.
Yes,
keep on running.
the gates open.
The gates are indeed now open and the patients flooded in. Nurses queued in Belfast and shots were given in Bristol. The biggest vaccination programme was underway, a feat that moved many to tears.
Well, it's been such a tough year for so many people.
How's that? It's all for Britain, that's right.
The Prime Minister met people whose only motivation was to stop the suffering. With more than 60,000 dead, it can't possibly come too soon.
It's amazing to see the vaccine coming out. It's amazing to see this tremendous shot in the arm for the entire nation, but we can't afford to relax now.
The NHS now more than ever will be in the spotlight. Getting this rollout right, a test every hospital must pass.
The logistics behind the Pfizer vaccine have been really challenging, but the NHS has risen to that challenge. We've had to store it at -70 degrees centigrade, We then have to thaw it, we have to reconstitute it and administer it within 5 days. And of course, this vaccine is like liquid gold. We mustn't waste any of it.
In 10 short months, the clapping here has turned from celebrating surviving COVID to protecting against it. Margaret was the first, but she is by no means the last. Emily Morgan, ITV News.
Well, for many of those receiving the vaccine today, it represents the chance to resume their lives again, to finally see family and friends after so many months apart, and to put an end to the fear of catching COVID. John Ray heard their reaction.
It is a tiny glass bottle and it comes packed with that most precious commodity, hope. So a quick dose of optimism in Sheffield for Trixie Walker after long, hard months.
It can't come soon enough. So many people have lost so much, and so many people have been bereaved. When it's rolled out to everyone, I'll be able to see my grandchildren again.
Before breakfast, the vaccine arrived, a miracle in the mundane cover of a cardboard box. And on a day of understated drama, a man named William Shakespeare was ready to play his part.
Groundbreaking, I think. It could make a difference to our lives from now on, couldn't it?
It is the biggest vaccination programme in British history. 800,000 doses will be administered in this first round, with patients in all 4 nations receiving their first jab today. Jubilation from Bristol to Edinburgh, a moment of comfort in the fight against COVID.
Nervous? No, I just want to have it done. I'd rather have this than get the actual COVID-19.
From Milton Keynes, one of 50 hospital hubs involved in the rollout, to Brighton, and a surgeon who knows too well what's at stake.
One of my good friends from medical school and his wife were both ill, and unfortunately his wife passed away. Another friend was in intensive care for about 8 weeks in Kent. So all of that has been quite traumatic.
Aubrey Bass, a veteran of World War II, calls this past year the worst of his life.
My wife died in March, so it's been very bad, but I'll get over that, sorry. Then I had to shield because I had pneumonia.
First, his friends, the best in the world, he says, and now the vaccine, the first in the world, should see him through. John Ray, ITV News.
The vaccination programme managed to reach its first care home on this, the first day of the rollout, with residents and staff at a home at Sydenham in Northern Ireland visiting. The science behind this groundbreaking vaccine is as impressive as its potential benefits. Most vaccines protect us by injecting a harmless piece of the virus into our bodies to prime our immune systems. But the science behind the Pfizer-BioNTech jab is totally new. This one instructs our own cells to make the vaccine themselves. A piece of genetic material known as mRNA carries a message into the body. It's packaged inside a fatty bubble, and that package makes its way into one of our cells, which then decodes the message held inside. It tells it to make a single piece of the COVID-19 virus, the spike protein, which helps the disease to spread. In response to these proteins, the body activates its own immune system, and that then prompts our cells to produce antibodies to fight them. The process effectively trains the body to recognise and destroy coronavirus should we become infected. Magic, isn't it? Well, the Pfizer vaccine is just one of the jabs which will eventually be rolled out right across the UK. The one the government rests most of its hopes on is being developed by Oxford University and AstraZeneca. Today, that was given a boost, with the latest trials confirming it is indeed effective and safe. That has, of course, increased hopes that the UK's vaccination programme will be a success. And as our science editor Tom Clark reports, the world is watching.
A 90-year-old grandmother from Northern Ireland got the first shot
when she agreed to be vaccinated.
Could Margaret Keenan have known hers was a shot that would be heard around the world? In this global pandemic, all eyes are now on Britain's vaccine rollout.
The UK has started to administer the
situation that even the woman charged with securing a COVID vaccine for the UK didn't predict we'd be in.
We didn't know whether or not it was going to be possible to ever get a vaccine against COVID-19. There were no vaccines for any human coronavirus. So we started from a position of complete failure, and the question is, could we develop a vaccine? And it looks like we've been able to succeed.
Her vaccine task force decided to bet on multiple vaccines, a strategy that appears to have paid off. The Pfizer-BioNTech vaccine is already being rolled out. We've got access to 40 million doses. We've ordered 60 million doses of the Novavax vaccine, which is still in phase 3 trials, as well as 30 million from Janssen Pharmaceuticals. But the government has bet heavily on the approval of the Oxford-AstraZeneca jab, ordering 100 million doses of that. Today, the latest data on the Oxford vaccine were published. They suggest more trials may be needed before it's approved by our drug regulator. But its creators are confident it will be.
I think a headline figure that we should remember that comes out of this analysis is that in 3 weeks after the first vaccination with this vaccine, nobody was admitted to hospital or had severe disease with COVID. What we should be really pleased about today is that there will be multiple safe and effective vaccines, and that's what's going to control this pandemic.
And that's great news for those further down the priority list, like clinically vulnerable younger people, shielding since March.
I just didn't see an end to it. But now, after we've had the second lockdown and this vaccine has came about, then I can't wait. I'm thrilled, and I'm very proud of the scientists and who has produced these vaccines.
Today was a big step towards stopping the UK's COVID outbreak, but also in the global call to arms to end a pandemic. Tom Clark, ITV News.
And our health editor, Emily Morgan, is here. First of all, happy V-Day. Very exciting, isn't it? You were in Coventry to see this first jab being given. Did you get a real sense of history?
I did, actually. It was hugely significant. I can't think of a better way to describe it than that. It really did feel in that room momentous. The joy that was coming from the staff and the patients was just so great, and the magnitude was immense. And I think just seeing Margaret sitting there, such an ordinary 90-year-old woman, so relaxed, not nervous, for me was just really quite humbling. And I've been reporting on the devastation of this virus for many months now. I've seen the trauma it's caused to NHS staff and to patients. And I think for me, just to see that vaccine going into the arms of people who really need it most was really quite something. I think Margaret today really became a symbol of hope. She has now really become a figure of historical significance. And I was pretty sceptical we would see any of that before Christmas. And I think I certainly am very pleased I'm wrong. And I think many people will agree.
Yeah, quite emotional. Emily, thank you very much for that. Well, we have, there is more on the vaccine on our website. We've included a look at some of the common myths about it, and that's at itv.com/news. Well, despite the vaccine, the outbreak is set to disrupt our lives.